Ever watch like a horror movie and there's that one scene, where like someone's crying and it's like, is that blood? And you're like, okay, come on. That's a bit much even for a horror flick.
Yeah, I know exactly what you mean.
Turns out it's a real thing.
It is.
So we're diving into Haemolacria today, which is the actual medical term for crying blood.
Mm-hmm.
And I got to say, I don't know much about this one, so let's figure this out.
All right, sounds good. Let's dive in. Well, first off, I think we should clarify that it's not always like the movies make it seem. It's not always like blood pouring from the eyes like you might see in a horror movie.
Okay, so not quite as dramatic then.
Usually not. It's often more about tears that are mixed with blood, so you might see a few reddish drops here and there. But that being said, it can still be pretty alarming, right?
Totally. I mean, I would freak out if I saw even a little bit of blood in my tears.
Yeah, of course. And it's not something you should ignore. And that's actually a good thing you brought this up because it's a good reminder to always talk to a doctor if you experience anything like this.
Oh, for sure. I was just thinking, like, imagine trying to explain that to someone like, yeah, so my eyes, they're leaking blood.
Yeah, a casual, oh, hey, doc, by the way, sometimes I cry blood.
Right. Just a heads up. But seriously, what causes this? Like, why would our bodies even do that?
Well, that's the real head scratcher. There's not just one single cause. It's actually a surprisingly diverse medical phenomenon.
Oh, really? So what are we talking about here? What kind of things can cause it?
Well, believe it or not, something as simple as a nosebleed can actually be a culprit.
Hold on, a nosebleed. You're telling me a bloody nose can make you cry blood? Seriously?
Seriously. And it all comes down to anatomy, really.
All right, hit me with the science.
So your tear ducts, right?
Yeah.
Those tiny channels that drain tears from your eyes, well, they actually have a connection with your nasal passages.
Okay.
So when you get a nosebleed, sometimes the blood can kind of, I don't know, back up is maybe a bad way to put it, but it can find its way into those tear ducts. It's like they're playing a game of bloody connect the dots up there.
Wow, I had no idea our bodies were so, I don't know, interconnected like that. That's both fascinating and kind of creepy at the same time.
Yeah, the human body, right? A marvel of nature. But hey, speaking of connections and stuff, sometimes the cause is a lot more, well, direct. Like the problem is actually in the eye itself.
Okay, that makes sense. So what are we talking about there? Like if the eye itself is the issue?
So you've got the conjunctiva, which is that clear membrane that covers the white part of your eye.
Okay, yeah, the conjunctiva. I think I remember that from like high school health class.
Well, it's incredibly delicate and it's full of these tiny little blood vessels. So even something as small as a scratch from like your cat,
Ouch, yeah.
or, if you get poked in the eye, or even if you're like me and a little too enthusiastic with taking out your contacts, that can cause bleeding.
Oh, yeah, I've totally been there with the whole contact lens struggle. So, okay, so we've got rogue nosebleeds and we've got sensitive eye membranes. Anything else we should be aware of?
Well, this one might sound a bit scarier than it usually is. High blood pressure can actually be a factor too.
Okay, now we're getting serious. High blood pressure, huh? I mean, it makes sense when you think about it, right? Like more pressure, more likely something's going to spring a leak.
Exactly. It's all about the pressure on those blood vessels. And remember, we were just talking about all those delicate little blood vessels in the conjunctiva.
Right, yeah. Super sensitive.
Well, when your blood pressure is high, it puts extra stress on those vessels, and that can sometimes lead to, you guessed it, a bit of bleeding.
So we're not necessarily talking like a blood fountain erupting from the eyes.
Yeah.
More like a few extra red drops getting mixed in with the tears.
Exactly. In most cases, it's not a gushing blood tear situation, but it's important to remember that in very rare cases, severely uncontrolled high blood pressure could lead to more serious issues, like blood vessel ruptures in the eye.
Yikes. Okay. So while a one-time thing is probably not a reason to freak out, if it happens more than once, definitely time to talk to the doctor about that blood pressure.
Absolutely. It's always better to err on the side of caution.
Okay, so we've got injuries, we've got blood pressure, anything else that could be causing this.
Well, sometimes it's related to how well our blood clots, like conditions like hemophilia where the blood doesn't clot as easily as it should.
Ah, okay. So if clotting is like, I don't know, having a good seal on a pipe with hemophilia, that seal isn't working right, so leaks are more likely.
That's a great way to put it. And those leaks can happen anywhere, including in the eyes.
Makes sense.
Yeah.
So are we talking like a whole spectrum here then? Like from a simple scratch on your eye to something as serious as a blood clotting disorder?
You got it. And to make things even more interesting, sometimes it can even be linked to hormonal changes,
Hormonal changes. Okay, now I'm really curious.
specifically menstruation.
Wait, hold on. You're telling me that crying blood can be related to, like, having your period?
In some cases, yes. It's a very rare phenomenon, but it can happen.
Wow. Okay, I had no idea. So what's going on there? Like, why would that even happen?
Well, it has to do with the hormonal fluctuations that happen during a period. Those fluctuations can sometimes cause bleeding outside of the uterus, and in some very, very rare instances, that bleeding can manifest as haemolacria. It's called vicarious menstruation.
Vicarious menstruation. So it's like
Yo.
our bodies are so in sync with our cycles that even our eyes get in on the action.
Something like that. The good news is that in these cases, it's usually painless and very temporary. We're talking a few seconds to a few minutes at most.
Well, that's a relief. But, okay, let's say someone's listening to this right now, and they're thinking, oh my gosh, that happened to me once. What if it happens again? What should they do?
That's a great question, and it's super important. Whether it's happened once or multiple times, the most important thing anyone experiencing bloody tears should do is see a doctor.
Okay, so when in doubt, get it checked out.
Exactly. Don't mess around with this one.
So what happens when you go to the doctor for this? Like, how do they even begin to figure out what's causing it? It seems like we've covered a lot of possibilities here.
It can definitely be tricky to diagnose. It really depends on the individual and their medical history. Sometimes it's something as simple as asking about like any recent injuries or if they've been having nosebleeds.
Right. Like, have you poked yourself in the eye lately?
Exactly. But if it's not something obvious like that, they might do some imaging tests like a CT scan.
So they can actually see what's going on inside the eye.
Exactly. A CT scan can give them a really detailed look at the structures of your eye and the surrounding area so they can see if there's anything out of the ordinary.
Makes sense.
Yeah.
What else might they do?
Well, they might also use something called a nasal endoscope.
A nasal what now?
A nasal endoscope. It's basically this thin, flexible tube with a camera on the end, and they can thread it up your nose.
Up the nose, huh? Sounds pleasant.
I know, right? But it allows them to get a good look at your nasal passages and see if there's any bleeding or anything else unusual going on in there. Remember that whole connection between the tear ducts and the nasal passages we talked about?
Oh, right. The
Yeah.
bloody connect the dots thing.
Exactly. So they might use the endoscope to check that out. And of course, they'll probably run some blood tests too, just to rule out any underlying medical conditions.
Wow, so it's a real full-body investigation.
It can be, because like we've been saying, there are so many potential causes. It can take a bit of detective work to figure out what's going on in each individual case.
It's kind of amazing when you
Yeah.
think about it. Like, something as seemingly simple as a few red tears can lead to all of this. It's like our bodies are constantly giving us clues, and it's up to the medical detectives to piece them all together.
That's a great way to put it. It's like a medical mystery.
It totally is. So what happens once they figure out what's causing it? What's the treatment like? Is there like a one-size-fits-all solution, or does it depend on the cause? Totally depends on the cause. Like,
Yeah.
you wouldn't treat a nosebleed the same way you treat high blood pressure, right?
Exactly. It's all about treating the root cause, not just the symptom.
So what are some of the treatment options?
Well, for something like a minor conjunctival injury, treatment might be as simple as some antibiotic eye drops, just to prevent infection. But for something like high blood pressure, that's a whole other ballgame.
Right, you got to get that blood pressure under control.
Exactly. So they'll work with you to manage that, which might involve lifestyle changes, medication, or a combination of both. And then for something like a pyogenic granuloma, they can often just remove that and you're good to go.
Okay, so it really is all over the map in terms of treatment. It makes sense, though, when you consider how many different things can cause it.
It definitely keeps things interesting.
It does. Well, I got to say, this has been a wild ride. We've gone from horror movie tropes to the ins and outs of tear ducts, blood pressure, hormonal cycles, all because of a few little red tears.
The human body never ceases to amaze, does it?
It really doesn't. But hey, if there's one thing I've learned from all of this, it's that if you see blood coming out of your eyes, or anywhere it shouldn't be, for that matter, don't panic, but definitely call your doctor.
Couldn't have said it better myself.
And on that note, I think we've earned ourselves a nice, relaxing, non-bloody beverage.
Sounds good to me.
Until next time, everyone, stay
Bye now.
curious.